Hi everyone, my name is Iris Linde and I work as a PhD candidate at Maastricht University and the Alzheimer Center Limburg in the Netherlands. And in this presentation, I will tell you something about the development of a patient decision aid to improve shared decision making on a timely dementia diagnosis. With an aging population and increasing media attention for dementia, the number of people presenting at their GP with questions like, my mom had dementia and I start to experience the same memory problems. Can I test for dementia? Or is it useful to test early for dementia because I understand that effective medicine is not available? And diagnostic testing for dementia in an early stage had advantages and disadvantages. Advantages are, for example, arranging matters for the future while you're still capable and arranging care on time. But disadvantages are living with a disease where there is no curative treatment available, which could cause depression or anxiety for the future. And more clinicians have this consideration that each individual values these advantages and disadvantages differently. And this results in clinicians favoring a timely diagnosis instead of an early diagnosis. And a timely diagnosis can be defined as diagnosis that's made at the right time for the patient and significant other to benefit most from their diagnosis. And to help patients and significant others find this timely moment, we aim to develop a patient decision aid. So what are patient decision aids? Patient decision aids are tools that contain information about a specific health condition and the available treatment options. They can be on paper or electronic. And their goal is to improve shared decision making between patients and healthcare professionals. And this can be done by identifying and comparing treatment options and exploring what matters to the patients and their significant others. And in this case, it's aimed to compare the option of testing early or testing in a later stage. And in this project, we developed a patient decision aid in 3 stages. But for this presentation, I will focus on the exploration phase, in which we asked ourselves the question, what are experiences of people with memory complaints, significant others, and general practitioners regarding the decision for diagnostic testing on dementia? And what out of these experiences should we consider for the development of this patient decision aid? So to explore this question, we had different methods. We conducted a systematic review on preferences for diagnostic testing on dementia of patients and significant others. We conducted qualitative interviews with patient and significant others on their experiences and needs in deciding on diagnostic testing on dementia. And we interviewed patient and significant others that decided to pursue diagnostic testing in a memory clinic, but were still waiting for their appointment. And we interviewed GPs on their experiences and needs in deciding on diagnostic testing on dementia, because general practitioners are usually the first point of contact when people become worried about their memory. So the decision-making process usually takes place in general practice. So there were a lot of points that we considered out of these inputs for developing the patient decision aid, but for this presentation, I will highlight a few of them. In our review, it became clear that people are often wondering whether their complaints are due to dementia or that it's just old age forgetfulness. And that this question leads to differences in the timing of seeking help. So we consider it important to include information on what differences are between normal old age forgetfulness and dementia, and when people should become worried about their memory. Out of our interviews, it became clear that patient and significant others need information on diagnostic testing for dementia. They are often wondering, what can I expect when I decide to go for diagnostic testing for dementia? What does it entail? Can it be done at my general practitioner? Do I need to go to a specialist? And out of the interviews with general practitioners, it became clear that we needed to include information on treatment possibilities, because general practitioners told us that they sometimes encounter patients and significant others that have excessive expectations on treatment possibilities, and that we should manage these expectations to give a realistic view on what is possible treatment-wise. And general practitioners told us to encourage people to use this patient decision aid together with their significant other, because they experience that people with memory complaints and their significant others sometimes have different views on when they want to go for diagnostic testing, but that they should make this decision together in order to make it a decision that they can benefit most from. So from all of these points together, we developed our patient decision aid, which is translated called Diagnostic Testing for Dementia or Not, and we are currently user testing it, and we hope that once it's implemented, it will lead to more timely diagnosis where patients and significant others can benefit most from. So thank you for your attention. And if you have any questions, you can always contact me.